Hey everybody, Dr. Stu Katzen here with Coach Eve on the next in our video series of taking care of your spinal health. In an early video we described the anatomy of the cervical spine, which is the neck. There's 7 bones of the neck, and we explained all the different sources of discomfort, dysfunction, or problems that occur there. And today I'm going to demonstrate how we would actually treat something of that nature, one of the ways we can treat it. So when a patient comes in, we discuss that I have to do an evaluation where I would palpate the spine, do my orthopedic neurological evaluation, check range of motion, and if there's any joint dysfunction or muscular dysfunction, we'd want to address that and resolve it. So chiropractically, once I rule out, I do my differential diagnosis and rule out any kind of thing that may be going on. And that may include a set of x-rays or sending someone out for an MRI. We don't know, but we want to check all those things out. But once we determine what's going on with a particular patient through our assessment, then quite many times a chiropractic treatment would then be, or musculoskeletal treatment would then be warranted. So what I'm going to do, I'm going to have Eve sit up for the beginning so you guys can see it from a video perspective, but I will have her lay down afterwards. So quite often there's also a soft tissue component. There can be a muscle spasm, there can be a tight muscle, there can be scar tissue, there can be some restrictions. So one of the tools that I prefer to use is an instrument called a vibrocussor. A vibrocussor is a vibrating instrument that vibrates and percusses at the same time. So it has a stimulatory effect where I can help elongate the muscles and the fibers, relax them, increase circulation, and does it feel pretty good, Eve?
Yeah, it's good.
Yeah, so most people really like this, but I also want to know that I don't use it for massage purposes, but I use it for its therapeutic benefit. This can help increase range of motion, flexibility, and again, as I mentioned, a stimulatory effect on the nerves. Now, some people have a question when it comes to manual work, whether manipulating the neck or things of that nature. Statistically, it is very, very, very safe. Some people just don't prefer to get their spine manually manipulated or adjusted. So one of the instruments we use in the office quite often is an instrument called an arthrostim. An arthrostim is a mechanical instrument, multiple beats per second, and what I could do is actually put it on the joint. Sometimes I'll increase people's range of motion, and at the end range, lightly tap those joints. I can specifically put it on a specific joint. I can also do it globally by working multiple joints if need be. And it's very delicate, and patients often tell me they like the way it feels. The outcome is what makes it feel even better. Now, I also can use another instruments. There are other instruments we can use to use the spine, and again, very gentle. And here's one of her misalignments, so I always like to get her adjusted there. Now, also manually, people do ask, so I am going to illustrate. I'm going to have Coach Eve lay down on her back, face up, and quite often during an evaluation, I'll determine if there's any restricted range of motion in the vertebra, so I'll use my hands. I will palpate the spine. I'll go back and forth. I'll check for any restrictions, any limited range of motion, any swelling, any edema, muscle spasms, and sometimes if you do find a misalignment, very gently, what we can do is manually adjust the spine very gently and help realign the spine. And then you probably didn't hear it, but there was some movement there in her spine. I knew that was one of her misalignments. Sometimes it's one side, sometimes very gently. We'll do on the other side, and it can be very, very gentle, just like that. And she's smiling, so she likes it. And that increased, now she has more flexibility and less fixation and a tension down. And double thumbs up on that one, too. Sometimes, take a deep breath in, relax. I'll do a little traction on the spine, taking pressure off the joints, off the muscle there. Okay, now I'm going to have Coach Eve roll over her side and sit up properly. And then palpate the spine. So the cervical spine's a delicate area, but a very important area because it is also close to the brain, and you also have the cranial nerves there. So that can actually make people feel much better, increase range of motion, flexibility. And I'm going to have Coach Eve let you know how it feels, because I know some people may have some questions about having their neck adjusted. So Coach, why don't you share one of the reasons why you get your neck adjusted, reasons you've been in here in the past, but also how it feels when it's done.
Sure. Yeah, it's super gentle, very effective. I suffer from a lot of motion sickness, so when I first met Dr. Stu, he helped me a lot with that. From a CrossFit perspective, when I do handstand push-ups or go upside down, I definitely always feel like my neck needs an adjustment and I'm out of alignment. So it's really great for recovery for that. Anytime I do strict presses, push presses, and put a lot of pressure on my shoulders, my neck seems to give out. So it's definitely my weak link, and Dr. Stu's great at adjusting the cervical spine. So 2 thumbs up.
Thanks. If you have any questions, don't hesitate to ask me or Coach Eve or any other coaches. We work with most of them. And feel free to look us up, come to the office, see us at CrossFit. And we're there to help you.